Open enrollment for Medicare has arrived, and open enrollment for the Affordable Care Act is close behind. Heather Massey is here from your Better Business Bureau to tell us how to recognize and avoid open enrollment scams. Well, what should we know about enrollment, Heather?
Well, Medicare open enrollment has already started and ends on December 7th. Affordable Cares Act is for those not enrolled in Medicare, and enrollment date ends on December 15th. More than 4 million Texans are enrolled in Medicare and over 1 million in the ACA. Overall, more than 5 million Texans are at risk for being targeted by healthcare scams.
Wow, 5 million. That is certainly a lot of people. So I'm so glad you are able to tell us some of this information. And why should consumers be careful during open enrollment?
Well, unfortunately, scammers are preying on people looking to enroll, change, or update their health insurance during open enrollment. Scammers may call consumers and refer to themselves as something like a healthcare benefits advocate, promising they can enroll you in a better, cheaper plan if you provide your Medicare or Social Security numbers. Other callers will intimidate consumers by saying their benefits have been suspended or discontinued due to a problem with their account. However, it can be easily solved if you just re-enroll by giving the fake representative your personal information.
So Heather, do you have any tips that you can offer our viewers in order to avoid healthcare scams like these?
Absolutely. Please be cautious with unsolicited callers. Medicare and the ACA representatives will not contact you via phone, email, or in person unless you're already enrolled in their program. Be especially suspicious of threatening calls that require immediate action or payment. Keep your information private and never share your health insurance plan information, government numbers, or banking information with someone you do not know or unsolicited callers. Giving this information to untrustworthy sources can make you vulnerable to identity theft. Also, check official websites if you're unsure about the caller or your enrollment status. Hang up the phone and visit medicare.gov or healthcare.gov to enroll or re-enroll in a health plan. If you also need further assistance, find the agency's phone number on their official site and always contact them directly.
So I know this is something we recently talked about, Heather, with public-private Wi-Fi. Now, if somebody's looking at, enrolling or maybe updating things with their health care plan, would you recommend people use that private Wi-Fi to log in?
Absolutely. While it is tempting to use free Wi-Fi, say you're at a coffee shop, this is not the time when you are enrolling in programs or accessing financial information. Doing the Medicare or ACA, you're required to do your Social Security number. This is a gateway to your identity. So make sure you're on secure Wi-Fi at home or at a friend or family's house, that you know this login information and access to Wi-Fi is completely secure.
And so I know you mentioned before about phone calls. They won't call you if you're not, already enrolled. So
right.
Say you do get a call from a person who says they're with Medicare or the Affordable Care Act. Maybe you're already enrolled and you're not really sure if this person is a representative. Should somebody ask for, like something through mail? Would you recommend that?
Absolutely. So any reputable agency is going to be happy to work with you and just send you something through the mail. If the caller on the other end starts to pressure you immediately, asking for that specific information like your Social Security number or bank account, no, this is a red flag. They don't work for one of these reputable agencies. Anytime you request that information, they should be happy to send that to you by mail. That way you can take your time, look over everything, and make an informed decision.
And where can viewers go if they do want to learn more about these healthcare scams or anything that we've talked about today?
Absolutely. They can go to bbb.org to find more tips on healthcare scams, or go to bbb.org/scam tracker to report fraudulent calls regarding Medicare and the Affordable Care Act.